Let's get into our first topic now, though. Should unvaccinated children be stopped from going to school to help prevent outbreaks of measles? Get your calls in for this one now, 0207 862 2222.
The World Health Organization has ruled that the UK is no longer a country where measles has been eliminated. It's after there were more than 3,000 recorded measles infections in 2024 and, tragically, the preventable death of a child in 25.
Now, in that same time period, vaccination rates amongst 5-year-olds hit the lowest level in 15 years, with just under 84% receiving both doses of the recommended MMR vaccine. It advises that at least 95% of children should receive the jabs just to ensure immunity across the country.
Now, to be absolutely clear, there are no current plans to make vaccines mandatory or to punish those who don't give them to their children in the UK. But in other countries around the world, excluding pupils who haven't had both jabs may in fact be an option.
And actually, Mike, you think that it should be an option here?
Well, I do, because I think it's preventable. And I think just giving the personal choice to the whole of the country to say you can or you can't is a very flippy-floppy practice. You've got to have a policy on measles. We used to be amongst the best in the world. That slipped back. And one thing I picked up was that one of the reasons it might be the case is parents' difficulty in getting appointments for their child to be immunised. How can that possibly be the case with the size of the NHS in this country? But what I'm saying is, I think the authorities have got to be clearer on who can go to school and who can't go to school, depending on whether they've had the jab or 2 jabs or not. And I'm afraid those who choose not to jab are going to have to suffer the consequences.
I mean, Mary, it would potentially be a way of keeping children who have been vaccinated safe.
It would, but I mean, much as I would wish that we had 95% vaccination take-up and therefore herd immunity nationally and across the country, and we have had measles elimination, which is not the same as eradication, but we've had that. We first had it in, I think, 2018, and it slipped back in 2024. We don't have it anymore, so that there are sufficient numbers of children who are unvaccinated to make it very dangerous for other unvaccinated children. So measles is now endemic.
But also, you look at the death figures, they're quite frightening. 20 deaths from measles between 2019 and 2025. That was the same as the number between 1999 and 2018, 20 years. So, it's a big problem.
But the thing about actually saying to people you can't go to school unless you've had the vaccine or your child can't, I think that's impossible to... I think it's wrong to say that. I think you have to give people choices in this kind of democracy.
But if you're putting the majority at risk, haven't you got to say... We've got to be very careful on the allowances we make to a tiny minority, because it is a tiny minority.
Where would you draw the line on this one? Would you say teachers have to have exactly the same as pupils, for example?
Yes, I would, yeah, because, a school's an institution, and therefore you've got to keep the risk of infection across everybody who's in the school.
So does this mean kids' parties, concerts, we do a COVID-type passport and children can't be included if they don't have the vaccine?
That being a perfect world, what I'm saying is it's much easier to organise in a school because a school is regulatory. You have, lists of people who are there. You can't do that in the situation that you've just talked about because it's too random.
Mary, one thing I would say is I spoke to my mum ahead of this to ask, first of all, if I had it, when I had it, and I did have it when I was very, very young. But I said, fast forward to now, if you had me in 26, what would be your response? And she said, we still would, but there would have been a question. Can you understand why there is doubt in people's minds?
I can, and unfortunately, most of the doubt is due to that villain, Andrew Wakefield, who's been struck off the medical register for producing fraudulent data, putting it in the Lancet, which is a very well-respected medical journal that's since been retracted by them completely, suggesting that there was a proven link between the MMR vaccine and autism. And that's been disproved in studies involving millions and millions and millions of people in hundreds of countries. The thing is that autism begins to show in children at exactly the same sort of time that these vaccines are given. And so there's no cause, but there's correlation, and he made a big fuss about that. And that stopped a lot of people. I know somebody who had a baby in a ward with an unvaccinated child, and the baby died. There was someone in the ward with measles. and the
shocking.
baby died. I mean, it's a really, really dangerous disease. And I mean, people don't really realise how dangerous. I mean, it causes all sorts of things. I mean, it causes pneumonia, it can cause blindness, and can cause
But it's treated as a
encephalitis.
joke, isn't it, largely?
It's treated as a
because
joke.
it only has 7
And
to
it
10
can
days
also-
and you know...
Well, thankfully, for a lot of people, it is just a disease that will be 10 days of horrible illness and then you will recover. Sadly, for many people as well, it's far more serious than that.
Yeah.
And don't we need body autonomy, though, Mike? And this will take away your own ability to decide what happens to your body if we start... Because it's basically making the vaccine mandatory.
Yeah, but you see, I'm of the view that if it's beneficial to the vast majority, then I'm afraid the minority have to, be told that this is something you've got to do. I just think the risks of saying, oh, well, all right, we'll let a few people into the school who haven't had immunisation is putting the majority of children at risk. And I don't think we can do that.
It's very interesting. You said putting this out to the populace to decide is a very flip-floppy way of doing things. They did it with Brexit.
Yeah.
Look what happened there. I mean,
but if you don't mind me saying, Brexit was a one-off, which we had to suddenly make rules up for. We've known about measles for 100 years.
Well,
you know
no,
what I mean?
but
we should have a standard policy.
Politically, it's the same thing, giving a choice or not to the populace to do things. And I think people have a democratic right to vote or not. I think they have a democratic right to take up vaccines or not. I wish that people did take up the MMR vaccine.
Yeah, but I don't think
I don't think you can force them.
I don't think they've got a democratic right to say no if it puts others at risk. I think the point is you've got to have a consistent policy.
But then what do you do? I mean, people drink and drive. Now, that's illegal, but people have a democratic right to drive their cars. And, in fact, they can drive dangerously when sober.
But you can't stop somebody coming out of a pub and getting into it if they're irresponsible like that. But you can make sure you can vaccinate your child.
Well, before we talk continuously about drink driving, we've got a split opinion, I think it's safe to say, in the studio. But Nicholas in Manchester, what do you say?
Yeah, I totally agree. Yeah, I don't think that goes far enough, to be fair. I think if you don't want your kids to take a free vaccination, that's helping the population. That nearly drove these diseases down and these viruses down. I think it should affect benefits if people are on benefits, and that would quickly make them change their mind.
And is that how far would you like it to go? It sounds as though for you want things to go as far as they possibly can.
Well, I just want people to understand, it's the whole point of vaccination is to protect the whole population. If people want to be anti-vaxxers and don't want to take that help, then should they take the other help, the financial help, the free house, the free car on benefits? They're quite happy to take that, but then they're going to say, no, I'm not going to protect my child. I'm not going to protect the other children in my school.
Nicholas, do you have children yourself?
I do, yeah, but they're grown up and they're both vaccinated.
So you vaccinated both your kids. So you've made that decision for your own children. But the crucial thing was it was a decision. And I just wonder whether we want to start taking away those decisions from people, because it could be a slippery slope, Nicholas. It could start with the measles. It could start when it is just having an outbreak, and then it could be compulsory for every child born that you have to have the vaccine. And then where does that end? We start to make other things compulsory for people and take away people's human rights.
Well, no, if it's tried and tested, like the MMR, with my kids had it. My kids are 32 and 27, and they're fine. They've never had it vaccinated. So we've got decades and decades of science that proves it works. The ones that we're talking about, we could go further, but at the moment we're talking about MMR, and we know they work through practice, through years and years of studies.
Yeah, and you're absolutely right. Vaccines do work to help suppress diseases. That is absolutely been proven. But it's also been proven that many, many vaccines have different reactions to different people. We all react differently to them. Sometimes people go get a flu jab and then they get the symptoms of the flu. Other people get the flu jab, have absolutely no reaction at all. But do you want to start dictating to people that they should take a vaccine when they don't know how their body will react to it?
We could argue that all day, but do we ban peanuts because certain people have peanut allergies?
Well, we do. We ban them on flights, so there are opportunities and moments that we do ban them. Yeah.
Well, in certain circumstances, yeah. But would you say, right, we're not allowed to sell peanuts worldwide now because people have these allergies, or gluten? We're not allowed to sell bread
Nicholas,
how far do you want to take that? We do know scientifically that the MMR and certain vaccines that we're talking about do work. Mm-hmm. It's scientifically proven.
Okay.
Well, Nicholas, thank you very much for what you said. I'd be very curious to know how much you'd be willing the government to spend on it. Alison from York, how do you feel about this one?
I feel that children should be made to have the MMR vaccine or measles vaccine for one simple reason. If you have a child who has critical illness and is needing to be cared for so they don't get any more illnesses or anything like that, if a child comes with measles and it crosses over and it causes more distress, and the parents that are wanting to keep their child safe and alive are having to to concern themselves about somebody just being not wanting to have the MMR vaccine. And I do agree with the gentleman before when he was saying that my children had the MMR vaccines. They didn't have it, but nobody around us had it as well. And that made it safe for our children to go and be with other children. It's not just wondering about school, it's wondering about life. When they interact with each other, when they go to sports, when they go to go and have parties.
Alison,
and stuff
I
like
understand the benefits of us all having protection from these horrible, potentially deadly diseases, and we need to get vaccine rates up to 95. But shouldn't we be doing that through education? Because what you're talking about when you're talking about mandatory vaccines is holding people down to vaccinate them. Is that something that, like holding a child down to vaccinate them, is that something that you would advocate?
I would definitely not do that to a child because it's infringing on the child's rights to be. But what I would say is that it should be brought into the attention of the parents when they're having the children that the risks are there, and to say to them, for the benefit of yourself and the child that you're going to have, that having the vaccine is it's not going to be as ill. If you've ever heard of a child having whooping cough, have we ever, how dangerous are those things? We don't hear about it anymore.
Yeah, I mean,
those
Alison,
diseases, because they've been controlled.
It sounds to me like you would very much like everyone to have the vaccine, but you would rather do it through education, just by speaking to you rather than making it mandatory. Thank you so much for your call. We can speak to Carol from Northamptonshire now. Carol, what's your views on not allowing children into school if they haven't been vaccinated?
Well, my daughter was seriously ill when she was young. She had the first one and then she had a very bad reaction and she ended in hospital, and they told her she couldn't have any more. So does that mean she would never have been able to go to school?
Well, I suppose under this rule potentially.
Yeah, Carol, how did you feel when you started to tell people about what happened? Were you believed? Because I think sort of underpinning a lot of this is a bit of government distrust across the board. So how were you taken when you articulated that?
Well, I explained to people that my daughter was that ill. Everybody could see that she was ill anyway. So it wasn't a question of, obviously because of what had happened. But I just feel, sometimes, you have to look at these things in individual, circumstances, not necessarily a whole point.
Yeah.
I actually think maybe...
my daughter...
I've just realised what you're talking about there, Carol. If your child has had a reaction to that vaccine, or she has just become so ill that she is incapable of taking any vaccines, then your child is the very child that we should all have the vaccine to protect, right? It's 95%, so your child would lie in the 5% of people that would be accepted. You would get some sort of a pass.
It also would be allowed a medical exemption certificate.
Yes, well, exactly. It's an exceptional case. Yeah. There's exceptions in everything. Yeah. And it would be madness to give that child a second vaccination, having reacted so badly to the first. So I totally agree with you.
But on the basis, Mike, that Carol says her child reacted so badly to the first vaccine, why are we making it mandatory for all parents to vaccinate their children with the potential that they could have a reaction? Well, perhaps not a fatal reaction, perhaps a reaction when you weigh up the pros and minuses that it's still better to have the vaccine, but it's still a reaction. Yeah, because 99.1% of children don't have a negative reaction to the vaccination. And I don't think you can suddenly say, because there's a 1 in 99 chance, you've got to introduce new rules. So it doesn't work like that.
The most dangerous reaction side effect from MMR, and it's only dangerous in minutes because it's always can be treated by the vaccine givers, but in rare cases it can cause anaphylaxis, but that's 1 in 1 million doses. That's 1 in 1 million.
So you're saying the anomalous would be the exception, that would be allowed here. David from Cumbria, how do you feel about the measles situation? Should children with measles be allowed in schools?
My view is I'm very pro-vaccine, but I had 4 weeks in hospital after the COVID vaccine with a raised heart, and obviously I still take the flu vaccine because you don't throw out the baby with the bathwater. You know, it's like just because you have a bad reaction to one set of food, it doesn't mean you starve yourself. So it's got to be. Basically, I'm not in favour of making it compulsory, but I think anyone that doesn't have the MMR, unless they've got a medical reason, are not that intelligent, I'm sorry to say, if that makes sense.
Well, David, I think that's... to be kinder to them, they may have been looking for their information in somewhere that was slightly skewed,
yeah,
potentially.
I
so
agree
they may have done their own
that.
investigations, but maybe in the wrong area.
Yeah, I agree with that.
Okay, so, but crucially the question is, should we stop children being able to go into school who haven't been vaccinated, and you would say no to that?
I think I would say no, because at the end of the day, I understand Mike's argument about protecting everyone else.
Yeah.
But I think people should have control over their own bodies. But
a child's too young, isn't it? Isn't a child too young
I'm
to have
talking
control
about
over
I'm talking about the parents here.
Yeah, exactly. Yeah.
Yeah. But, I mean, if parents have got wrong information, that's always a problem. But
so maybe this comes back to education, David, and just maybe a public message, something to...
Absolutely, because the MMR vaccine is obviously safe for 99% of people. And obviously, if they did make it compulsory, they'd have to have exceptions for, like in my case or like in Carol's case, who was on before, you know, because you've got to, you can't ban somebody because they're medically exempt from having that vaccine.
So, David, if we park the medical exemption, how would you feel about potentially punishing a child for the decision of a parent?
Oh gosh, that's difficult, because you can't really punish children for. Adults.
I don't think you are punishing a child, are you? I mean, you're assessing a situation in the relationship between parent and child, but it's the parent who makes the decision. You're not punishing the child.
Yeah, but you are punishing the child if you say they can't be educated.
No, that's the parent's decision.
But it is a punishment for the child, because the child misses out on so much.
Well, thank
Absolutely.
you. David, thank you very much for your call and for your insight. Thank you for all of your calls, but don't go anywhere, because after the break, we're taking your calls on whether King Charles is right to campaign about climate change.